All right, I want to say good afternoon to everyone. Welcome to our Wake County Board of Education work session this afternoon. We'll go ahead and get started since we're running just a little bit behind schedule. We apologize for that, but our Student Achievement Committee meeting ran just a little bit long, and of course this being a special call session so that we can accommodate and get all the work in that we need to do today. So we'll jump right into it. We've got one item that is part of our agenda today, and that is a discussion for the board and review of end of first semester in-person instruction. And so we will take some information today and hear some information from Superintendent Moore and staff, and then look at taking some next steps to inform our decision about how we move forward with instruction in the next few weeks. So with that, I'll turn it over to Superintendent Moore, and we'll get started. Superintendent Moore.
Thank you. Good afternoon, Chair Sutton and board members. Our presentation this afternoon, we moved around a couple of things. Thought it would be helpful to start with some updates from Dr. Benjamin and the ABC Science Collaborative, who is, I believe he is online, and we'll go ahead and get started with him. He has a few items that he's going to provide some updates and information on, and then we'll move into the staff presentation.
Great, thank you. Go ahead, next slide, please. As usual, just next slide, just to remind everyone, anyone who's new to these calls, for our suggestion to follow the Strong Schools Toolkit, DHHS guidance, and that the faculty from the ABCs have really no decision-making authority and don't give specific advice as to whether or not schools should or should not be open, rather to provide data to help inform those decisions and to help frame the questions and the thinking around some of those decisions based on the science available. Next slide, please. So there's new CDC guidelines for the reopening or staying open of schools. That's nestled within a larger guidance document around guidance for communities in the setting of widespread transmission. Schools are addressed specifically and briefly in that document. One of the quotes from that CDC guidance is that schools should be the last to close and the first to reopen when they can do so safely. Now, the guidance document covers a broad range of society. It's not just limited to K through 12 schools. It includes other educational settings, businesses, home life, social activities, restaurants, and more. The statement does include the important clause, when they can do so safely. This is important because it assumes that some of the mitigation strategies that are particularly relevant to schools, which are well known now to be the 3 W's, wearing a mask, waiting 6 feet, the distancing that is supported, and the wash hands are included among those strategies. The distancing especially becomes online and is key around whenever masking is not in place, especially relevant at times of breakfast, lunch, and water breaks. And although testing is noted to be potentially helpful in the college dorm setting, it's not at all clear if testing is helpful in the K through 12 setting as far as managing the pandemic. But testing can be helpful to exhibit how effective one's mitigation strategies are, and is not currently a condition of in-person instruction for K through 12. And I don't think that it will be that there will be uptake of that as a requirement for in-person instruction. I'm talking with the CDC. The second item is that the CDC recently moved from 14 days for quarantine to an option of 14 days or 7 days with a negative test. This is first and foremost something that you all as a district will need to be in line with what your state guidance is as far as DHHS, which should have input on this and will have guidance on this downstream. As a reminder for not only board members but for the public, in other settings, foremost among those either clinical care given in health departments or in outpatient clinics or in free clinics or in hospitals, if the providers, whether they are physicians or phlebotomists or nurses, what have you, are masked and they are exposed to a patient who's positive, who is also wearing a mask, the quarantine that you all have to do currently in schools is not done so in those healthcare settings. And so this move by the CDC, this suggestion moves you a bit closer to other areas of society as it relates to quarantine. Again, this has not been taken up yet by DHHS in North Carolina as of at least this past weekend. Go ahead, next slide, please. So I've been asked several times by school board members about interim data from Plan A. Since you do have an important decision in front of you, I wanted to give you very briefly that 5 districts that have been in Plan A since the beginning of October have provided interim data halfway through the quarter here. So some of these districts went to Plan A on October 5th. Some of them waited until the 19th. These really are sparse data in the sense that they only come from 5 school districts. They really should be interpreted with caution. There's no difference in those 5 districts with respect to within school transmission. A couple of the first 11 school districts never did go into Plan A, and a couple of the first 11 school districts from which you've received earlier data are in Plan A, but they've not given us documented in writing data that we could review. So I would not overinterpret these interim data looks. Reassuring, but interpret these with caution because it's early. The recent CDC guidance. So the CDC outlines when they can be safely reopened. To my eye, the Wake County data thus far has been, albeit imperfect, it's reassuring. There's, to my knowledge, has not been a cluster within the county or secondary transmission. The CDC guidance, please note that it does not advocate Plan A or Plan B in the North Carolina system. It doesn't get to that level of detail. And as Wake County schools and the recent CDC article, certainly Wake County is following masking and contact tracing. Distancing is especially important if not masked. The CDC does emphasize at the moment for quarantining and for aspects of its policy, 6 feet of distancing. And then some items are clearly not relevant. They're relevant to other aspects of society, among those testing. Now, to my eye, I get asked around closing, and I am, as usual, not going to suggest closing or opening or staying closed or staying open. The 2 reasons, however, to close, number 1 is the virus, and you all have in front of you in the prior meeting are thinking on when one closes for the virus. That's documented by within school transmission, secondary transmission, or clusters. That has not happened in Wake, certainly has not happened to the extent that it warrants a safety look. So as far as the virus itself, Wake County, at least to the metrics that we've suggested school districts consider, Wake County's doing an outstanding job. The other reason to either close or to scale back in learning platforms relates to staffing. Naturally, that's far beyond my expertise, and I have no opinion about that. That relates to quarantining and staffing challenges. I'll say, as it relates to the pandemic, in addition to typical coverage, districts want to make sure that they have sufficient staffing to continue to adhere to DHHS guidelines on the toolkit, the 3 Ws, and the 12 principles. Quarantine and implications. We are revisiting quarantine with CDC. We've discussed their quarantine policies with them with some length. We're going back and forth with the North Carolina data with them as it relates to quarantine. I don't think that there'll be much of a change on that in the next couple of weeks. And so in the meantime, given what you've got as it relates to quarantine, close collaboration with North Carolina DHHS is warranted as far as your options there. With that, I'll wrap it up. I only had 2 quick slides for you all.
So, Dr. Benjamin, thank you for that. And of course, we are thankful for your presence. We know you've got a busy schedule. And I guess to provide some context, that's probably obvious to you and pretty obvious to the public, but I'll just say we are here today to consider this discussion because, against the backdrop of obviously rising health trends and data that are moving obviously in the wrong direction, changes to the governor's orders in response to those increasing numbers. And as indicated on your slide, we have some obvious maybe not so obvious, but some staffing challenges of our own that we are trying to address. And I would say to some degree, some level of surge from the Thanksgiving holiday and perhaps in anticipation of some surge coming from the upcoming holidays. So that is, part of sort of the reason why we're here to discuss what some options are to ensure smooth and efficient operation. I guess my first question to you and open up to the board and the CDC guidance, I would not expect the CDC to advocate for a plan A or plan B in our state system, as every state probably has a different sort of system. But I think what would be helpful to hear from the CDC, are there any best practices or what plans do they see working across the country in schools, and what strategies, or what we might learn from some of those strategies. For example, we've heard suggested that even a half day. You talk about the wearing of masks during lunch, and I think I've seen some emails a suggestion of a half day of school instead of an entire day, and students will not eat lunch at school, for example, but eat lunch at home. Is that an effective strategy? Have you heard any districts trying anything like that, and do those types of things work? And the larger question again, what do you hear from the CDC in terms of any specific strategies that might be useful to us as a large system?
Sure. So a couple of items. Number one is about the half day. So and we discussed that very question on the call, and I'll frame this to you exactly how I framed it to school leadership. Folks down at the CDC who are working with schools. The advantages to half day are that they provide some logistical advantages to schools, but they provide some real logistic challenges. Foremost among them is typically in that setting, not only are you doubling your bus routes, but more importantly, you're often taking children and handing them a lunch, a bag lunch to go home. And so here you have a child who, maybe at 11 o'clock in the morning, they haven't eaten since 7 a.m. I've got a bag of food in front of me. I'm getting ready for a half an hour bus ride home. I know exactly what I'm going to do. And in that setting, you're going to have a lot less control over the individuals on the bus than you might in the school setting. So you really want to think through the logistics of how the children are going to be fed in that setting, whether you're going to use, how that's going to happen. That's a non-trivial challenge. And you do have cameras for many of those buses, but again, how do you ensure adherence to the children in that more closure setting? The second thing around the larger school district challenges, I think that the question of staffing for you guys is very much on the minds of the school leadership team down there. And there are some, no solution is perfect, but the encouraging a test as a condition to come back to the school environment more quickly has some advantages in the following sense. If, no matter what, when I have close contact, I am destined to be home for 14 days, and I am not sick, there is an inclination, even if I am told by the health department, hey, I should go get tested, that perhaps I may not get tested. The testing is incomplete. But if I am motivated to be able to return to the school environment, maybe a little bit quicker by documenting a negative test, it encourages a behavior that from a public health standpoint, it incentivizes a behavior that we might like to see, which is increased testing. Again, this point is not especially relevant today because you've got the North Carolina state thinking on this. There are pros and cons to such an approach. My encouragement for the board members would be to think through what the pros and cons might be. And my encouragement to the staff is how to mitigate against some of those cons if you were to have the state encourage such a policy, and if as a board you would like to uptake such a policy.
Thank you for that, sir. Ms. Mahaffey.
Thank you, Chair Sutton. Dr. Benjamin, thank you. I'm not sure if you're going to be here with us tomorrow. And so back in the fall, as we were contemplating coming back from the remote environment back into the school environment, it was the collaborative's recommendation that a slow cohort-led return to schools was the way to go. Is that still the recommendation of a phased cohort roll-in upon a return to school?
So just to clarify, we don't have an opinion about whether or not you phase it in 3 cycles or 50-50 or small groups. What Wake did was certainly in the spirit of what we suggested, which is make sure that your procedures work in smaller groups of students rather than bringing everyone in all at the same time. And Wake has certainly done that. You can see from the lower population density setting, if you will, Wake being in hybrid initially, and rolling in as they did, you can see early data that Wake teachers, bus drivers, cafeteria workers, principals, and superintendent staff, they've got policies in place that you've got preliminary data that your people are doing the right thing, are succeeding. And so to my eye, you've done the phased-in approach. You've done proof of concept that your policies and procedures are working.
Thank you.
Dr. Martin.
Thank you. Thank you for always the update. A couple comments and then a question. From a comment, I think it's important that we put on the record the full quote from the CDC article that says schools should be the last settings to close, quote, after all other mitigation measures have been employed, and the first to reopen when they can safely do so. The reason I want to emphasize that is because it's very clear from this manuscript that you sent around to us from the CDC that the school closing opening decision is not an isolated decision of schools. It really is a community-based decision, and CDC very clearly states that with that clause, after all other mitigation measures have been employed. So I just think that's really important to emphasize. This is a community decision that for the schools to be able to make their decision, it depends on the restaurants, the theaters, the gyms, the bars, and everything else. And so it really is a cooperative decision. It is not the schools on their own. So I just wanted to emphasize that because I think that's a really important takeaway from the CDC article. The second comment from the CDC article, I think it's also very important to state that the clause is not really distancing if not masked. The assumption in the article is distancing and masked. It's not an or. And that goes with the World Health Organization guidelines as well, that are also very clear that it's masking and distance. The distance can be shorter if you're outdoors, larger if you're indoors. So I just wanted to clarify those two comments, which I think were, in my mind, were very clear from the CDC article. My question it relates to the Plan A, Plan B, no difference. And I think we can all agree that there has been no clusters. I think we can all agree that there has been no major within school transmission to the extent that it was seen in college campuses and dorms and fraternities and whatnot. At the same time, when you look at our data, which I have done and I've shared with you and others on the board, if you simply look at the number of cases in our elementary schools and compare it to the number of cases in our middle schools, there's a clear differential. There are many more cases in the elementary school than there are in the middle school, and that's both in the staff and the students. And that still is the case even if you normalize for the number of grades, right? There are, K-5 is 6 grades, but middle school is only 3 grades. And the differential really spreads at the time when we went fully in person for Plan A for K-3. So my question is, how do you explain that data in conjunction with the statement that there is no difference between Plan A and Plan B? Because I'm having a hard time understanding anything other than that between the elementary and the middle, since the general assumption is the younger children should be infected less than the older children, and yet we're seeing the inverse. So help me understand why I should be seeing that differential. Again, it's not huge, but it is absolutely significant.
Yeah, so let me explain the no difference between Plan A and Plan B. And again, I just want to really encourage caution with even just taking that statement out of context. So when I had mentioned no difference in Plan A versus Plan B, remember that the key deliverable for schools are to prevent within school transmission. Mm-hmm. And so in Yadkin County, for example, the difference in secondary transmission in elementary schools in Plan B versus secondary transmission in Yadkin County in Plan A, there's not a difference. In elementary schools in Alexander County in Plan B and Alexander County elementary schools in Plan A, no difference in secondary transmission. It's the same for each of the 5 counties that have submitted data in writing. As far as the Wake County primary or community infections or all-cause infections, if you will, that are reported by age, that's a much more difficult, it's very difficult to make a formal interpretation from those data, and has real challenges to interpreting those data because of uncertainties around the denominator.
So I understand the uncertainties around the denominator, but the point is the denominator is not changing, right? It's all elementary school students, all middle school students. So the denominator is not changing. So we've taken that out. I agree that there's denominator issues if you look at it compared to all of Wake County, but we're looking just at our schools. That denominator is not changing.
Yeah, so again, comparing, so I have not looked at Wake County data in the student versus staff by school, by week, in part because I would need to go through permission to look at that. All I've got permission to look at is aggregated numbers, and aggregated numbers comparing primary and secondary transmission. When you start getting down to students versus staff, this has some IRB. I would need to talk with folks at IRB and Duke before starting to accept some of that data. So that's not a question that I have looked at in detail. I will say, however, that interpreting subsets like that can be a real challenge, making those types of comparisons. And I would just encourage you to focus on how much infections that you have going on within the school, and to think about strategies to improve your detection of that, and more importantly, think about your implementing strategies as far as preventing that.
I would encourage us to try to find somebody to help looking into this data at a deeper level. I can't, because all I have access to is the publicly available data, but I think we really do need to get a public health official to look into this data very carefully. Again, we're not at an extreme setting of secondary transmission, but there is reason that we should take a look at these trends early as opposed to waiting till later. Thank you.
Mr. Haggerty.
Thank you. And if I could, I have a question for Dr. Benjamin, but first I'd like to just query Dr. Martin a little bit to make sure I understand his point, because like the numbers that we get reported to us are, if we're looking at the same thing, cases of positive tests that have been identified in the schools, but they're not necessarily, and they may not even be at all, cases of within school transmission. Is that right?
So the point is, we don't really know about in-school transmission or not. We're reliant completely on the health department saying that there was in-school transmission or there wasn't. If there's an asymptomatic person that gives you the virus, you will not know whether it's primary or secondary. That's just a reality. And so the data that we get, you're absolutely right, and you know, I've got a spreadsheet of all of it, and I keep track of it. we get the school that they're associated with, so we can disaggregate for elementary versus middle versus high versus not in school. So we got 4 aggregate places to differentiate.
Right.
And then we also get student versus staff so that we can disaggregate. We can look at it school by school, but the numbers there are, with very few exceptions, are not high enough to draw any significant conclusions. But we've got a large enough population sampling that when you can look at all of our schools, you actually do see a clear differential in trend that there are both a greater number of staff and student infections at the elementary than at either middle or high. And that is, right, the best we can, normalized for populations, normalized for grade levels and whatnot. But even if that normalization factor is wrong,
Yeah.
elementary to elementary to elementary is not changing, middle to middle to middle is not changing. So that's the information that we have.
Yeah.
It would be very good to take that one step further and be able to differentiate, are the staff that are infected, for example, teachers in the classroom versus staff that are custodians, child nutrition workers. I don't think we're getting the bus driver information because I don't think they would be associated with the schools. And we have a very small number of cases with people not directly associated with schools. So it would be very interesting to get the next level of data. You and I don't have access to that.
Yeah.
That's why I'm saying there needs to be a public health expert who has authorization to see that information to look at that next level of analysis.
Okay, thank you. So, and then to the superintendent, is that something that we could see if we had more contact tracing resources, or is that something that right now is beyond our capability?
Right now, we have access to what is reported to us that we report to the county for confirmation. If there are, for example, if there are students in virtual academy or teachers who have accommodations who aren't ever in the school building but are positive, we wouldn't know that. I think that if we redefined a little bit what we do with contact tracing, and I'll talk a little bit about that today, but we do have an update on some efforts with contact tracing that we're going to undertake as a district as part of tomorrow's work session with more detail. But having greater ability, more people, quite frankly, to address the questions and to pull on some threads and get some more detail, yes, we could have better information.
Okay, thank you. So, Dr. Benjamin, my question is, as you look at these factors and you analyze data from schools, district to district within the collaborative, I know that you're looking, it seems like you're looking primarily at different policies, practices, trying to identify best practices, compliance with the practices and policies that have been set. Do you break out or do you look at any significant differences from district to district in community spread numbers? And what I mean by that is, say you have 2 school districts that are employing the same practices, but perhaps one has higher rates of community spread than the other. Do you see that if they have the same policies and the same level of compliance, that any within-school transmission seems to be about the same? Do you see that if there's differences, it's proportional to the rates of community spread, or is there some tipping point where if community spread reaches a certain level, then even if practices are in place, you see more infection?
Okay, so if schools are implementing policies and public health mitigation strategies, then community transmission has had 0 predictive value on secondary transmission. If you don't put in mitigation policies, then community transmission, once it gets above, well, we're way beyond the community transmission that one needs to get COVID to be like wildfire in a school, and have been for months throughout the state of North Carolina. Most of the school districts that were in the open in the first 9 weeks had rates in the community that you are experiencing right now. There are districts with rates in their community that are 2- and 3-fold higher than what you are experiencing in Wake County right now, that are open and are able to prevent secondary transmission. The key to protecting the adults and the children in the school are the public health strategies inside those schools. And once you get up above a very, very low transmission rate, and this is evidenced in Western Europe, if you send these kids to schools without masks on, you are asking for trouble. If you get up to very, very high levels of transmission, you can run into real problems with staffing. Where the tipping point for staffing is depends on a whole complex number of factors around size of the district, capacity, substitution availability, all sorts of things that are extremely variable district by district. So there are districts that struggle with staffing at a rate lower than what you have in your community, and there are districts that are handling staffing that have a community rate much higher than what you are experiencing. I don't have an opinion as far as staffing is concerned, other than to say there is a tipping point somewhere for Wake, just like there is for Yadkin, just like there is for Iredell. And your staff leadership are the ones to give you input on that. I know that it exists for you. I just don't know where that point is.
Thank you. I appreciate that.
Certainly.
Mrs. Cash.
I do feel like those 5 counties, the data coming from those 5 counties or LEAs, are very credible for us, because it is measuring the things that are, I think the collaborative has done a really good job of putting together the factors that we really need to look at. So I just want to be sure that my opinion's weighed in on that one.
Thank you. I will say that, when you've got data, you really want to be careful about over-interpreting it. And as a research group, we want to be very cautious before over-interpreting our own data, especially in the public domain. So I'm hopeful about it. I gave it to you in the spirit of transparency, but it has not been vetted by multiple people like the first round of data that I presented to you a couple of weeks ago. It has not been discussed with North Carolina Health and Human Services. It hasn't been discussed with leadership down at CDC. It's really, I would like for you guys just to be careful interpreting those data right now. It's early.
Mrs. Kushner.
Thank you, Chair Sutton. And I have a couple questions based on what Dr. Benjamin told us. And one would, you talked about the pros and cons of testing. I'm wondering, what are the cons of testing? I don't know if there would be negatives of testing our students or staff. I can understand capacity might be the one con, and focusing on staff versus students. That makes sense to me. But also the changes from the CDC on quarantine, how is that going to change both Dr. Benjamin and Ms. Moore, how will that change our ability to get improved staffing or our teachers back in the building a bit quicker? And also, if you could address false positives and how, if we're able to go back with testing and get a false positive found out through a subsequent test.
Ms. Moore, do you want me to go first, or do you want to address the staffing question first? I'm happy to take some more of the epidemiologic-related questions if you would like me to.
Well, let me just speak to the staffing piece. In the event that we adopt we're able to implement a quarantine policy that allows for a shorter period of time with testing, that is a shorter number of days that we do need subs in schools. But it's a little more nuanced than that even, because
It'll still require a negative test, right?
right, it will still require a negative test,
So if you
absolutely.
have a positive and it's a real positive, it's 14-day quarantine still. The 7 days is if it were a false positive.
Asymptomatic
Okay.
exposure and testing. And I think that the nuanced piece of it really has to do with how we currently define exposures, right? So at some point, there's going to be research or information that speaks to the number of folks that are quarantined that have been deemed exposures and what we're seeing in secondary transmission coming out of those. I don't know if Dr. Benjamin has any updates on that. But we're doing what we're being asked to do, and it's out of an abundance of caution as we learn more about the virus. But even with a shorter quarantine period, in addition to potentially being able to implement a shorter quarantine period, if we can do that safely within the requirements that the CDC has outlined, it is also important to note that I believe the CDC will continue to also work on and look at what an exposure means. How do you define an exposure?
So that's yes. When we spoke with representatives from CDC, we talked about the challenges around everyone has 14 days. And there's several challenges. One is the frustration that you're feeling right now. So you sit out for 14 days, no matter what, that can lead to real staffing problems. That can be helped by saying, okay, 7 days at the negative test. There are a couple of potential drawbacks to that. Drawback number one is that it can give folks a false sense of security. So in that setting, you want to be all the more confident that your mitigation strategies are strictly enforced. Because when you do have secondary transmission, certainly in the healthcare system, far and away the most common healthcare transmission has been when staff have gone into the break room to eat with each other and taken off their masks for a prolonged period of time in one-on-one or two-on-two conversations a short distance away from each other. Okay? You don't want people thinking, oh, I had a negative test yesterday, I'm good, I don't feel like wearing my mask, I'm going to hang out with my friend. And humans will behave like that from time to time. So whether those humans are 16 or 32 years of age. That's potential drawback number one. You really want to make sure that you continue to treat everyone who crosses the threshold of the schoolhouse door as though they are infected at all times. Number two, you can get into situations where some folks have access to testing and other folks maybe don't have as good access to testing. And we don't want to be in a situation where that could be a problem. In discussion with school leadership from various districts, there are districts that are already thinking through ways that they can help mitigate against that potential problem. And whether it's by improved communication or hooking folks up with resources. That's why I'm bringing up this particular potential change in policy to you now, because whether it ultimately changes in January or June of 21, you're going to want to spend some time grappling with that potential challenge. Now, as far as false positives, because you can express the virus to varying degrees on different days, and you can have a differential viral load on different days, and therefore variable sensitivity and imperfect sensitivity on some of the testing, typically you want to look at a positive as that's a positive, we're done here, rather than retest, hope for a negative. I think that was all your questions.
No, thank you. That makes sense. That makes sense. And there are, I think we need to acknowledge that there are non-Wake County schools, both private and charter schools, that are having clusters of COVID in their schools. Are they sharing information so that we learn from protocols? Are they closing? I mean, what are the patterns that we might have to be cautious about, given that we do have schools in our community that are having COVID clusters in the private and charter setting?
So if you look at the best data coming in from the first 9 weeks of instruction, because you've got kind of a beginning and end and to wrap your hands around. In that first 9 weeks of instruction, the private schools represent, I'm going to ballpark it here, about 10% of the instruction. But they represented over half of the clusters. So there are a lot more clusters in the private schools. Now, in private schools where this has been a particular problem, there have also been more cases with each cluster. And I don't have proof of this, it's just my gut feeling from talking to superintendents in the lessons learned process that we go through. So we meet with superintendents from throughout the state every week to do a lessons learned whenever there's a cluster and whenever there's substantial secondary transmission in any of the schools in the ABC Collaborative. The superintendents that are part of the ABC Collaborative tend to be extremely quick thinking, quick acting as it relates to, oh my gosh, I might have a cluster brewing, or I've got a cluster that's emerging, and are acting very quickly by and large. I don't have as good a feel for that in the private school setting, in large part because we are not working with many of the charters or private schools. But as I look across the data, the traditional public schools have just done an outstanding job in the state of North Carolina, on average.
Thank you. That's all the questions I have, Mr. Sutton. Thank you.
All right, so Superintendent Moore, I'm going to toss it to you, Dr. Benjamin. Thank you for being with us. I don't know how long you'll be able to hang out with us, but we certainly encourage you to do so as we go through the rest of the presentation from staff. And if you have to drop off again, thank you for your time and thank you for being with us.
Thank you. Thanks for having me.
Yes, sir.
Thank you, Dr. Benjamin, and thank you, Mr. Sutton. So as we move back into the presentation with a first semester update, we'll start with, if we can go ahead and get the slide deck up. You will recall that as we have planned for the reopening of schools and in-person instruction, we have discussed that there were really 3 areas that we would continue to monitor and look at, that we would react to or plan for as we made decisions. The first one is any new or additional information, executive orders from the governor, things from DHHS, that sort of thing. The second one we mentioned, that we've talked about, is our collaboration with and learnings from state and local health officials and the ABC Science Collaborative. And then the third one was to monitor implementation of our district's current plan and programming. So those are the 3 things that we would continue to follow and pay attention to. And of course, the reminder at the bottom that, you know, we likely, looking at these different factors, may need to modify our plans from time to time based on what we're seeing. And we would bring that to the board for discussion, review, and decision as needed. So moving on. So we have seen changes in all 3 of these indicators at some point since the school board last met. And each of these changes, these indicators, are connected in some ways, or they either reflect something that's happening in our schools or connected to something that's happening in our schools. And so there is an impact. And in some cases, that impact does affect the manner in which we're able to deliver in-person instruction. So, for example, last week, Governor Cooper issued Executive Order 181, which tightened current health guidelines due to the increasing spread of COVID-19 across the state of North Carolina. If you listened to the governor's briefing, I'm sure you heard him, as well as Department of Health and Human Services Secretary Mandy Cohen, use the word dire several times in their comments. In many ways, the changes in Executive Order 181 do not affect us directly, such as the stricter stay-at-home orders that fall outside of the normal hours of school operation. However, the one caveat that I will add to that is that given our athletic competitions that are getting ready to start, the requirement that everything be done by 10 p.m. might have an impact. So we'll be looking into that as we move forward. However, the underlying reason for the tightening of the restrictions for North Carolina in the governor's executive order, namely a significant increase in community spread, do have an effect on our ability to do business. Within the past week, the North Carolina Department of Health and Human Services changed the status of Wake from a county with significant community spread, or yellow, to substantial community spread, orange, based on increased cases in the county. And I believe that as of today, for Wake County, we've hit 8%. And more importantly, in our operations, as the rate of increase accelerates, and this is happening according to local health officials and in our community, what we have found in Wake County is that we now have had reported over 33,000 cases, more than 300 death totals. Those are numbers that you can look up. And even more significantly, in November, we set a record for the number of cases in a month at 7,443, and local health officials have said we will surpass that number in December. The 7-day rolling average for Wake County as of late last week was 480 cases per day, which is a doubling of the rate since Thanksgiving. While pretty much everyone anticipated an increase after Thanksgiving, I think the rate of that increase, even though it was expected, is more than perhaps what we expected when the board discussed our first and second semester plans in the last few months. A relatively bright spot amongst the news in the last couple of weeks is really that we have a lack of confirmed spread, secondary transmission on our campuses. While the actual number of confirmed cases among students and staff has increased noticeably over the past month, We have yet to have confirmed spread on our campuses. This means that we do not have evidence that people are infecting each other in campus in a significant way. There is no hard and fast draw the line on any of this, but we don't have that information evidence at this time. Given the rapid spread of COVID-19 cases in the community, the lack of secondary transmission, the lack of evidence for secondary transmission on our campuses really does tell us that our folks are largely complying with those 3 W's: wearing a mask, waiting, creating as much distance as possible amongst folks, and thorough hand washing and sanitation. Our folks' willingness to adhere to those guidelines is to be commended. They're to be congratulated, quite frankly. It is one of the few bright spots in recent weeks. But the number of students and staff that are exposed to the virus in the community has jumped significantly since Thanksgiving due to the rapid increase in rates. And we have talked about that what you see in the community, you will see in schools. And our job is to do everything we can to prevent secondary transmission. In short, the community spread, not the spread on our campuses, is impacting our ability to operate our schools. When all 3 of the factors on this slide are considered together, what we're seeing increasingly for the third part is that our principals are reporting staffing shortages due to the number of employees who are being told to quarantine after coming in contact with infected individuals while off campus. So as we take all 3 of those into account as we think about the next few weeks, we have concerns about the days following winter break. At the moment, we see nothing in the community health data that suggests current trends will reverse themselves in the next 2 weeks. What we hear consistently from state and local health officials is that those numbers are likely to increase. Another surge in early January would not be surprising given the increases after past holiday breaks, most recently Thanksgiving. But unlike even before Thanksgiving, when the virus was more contained than today, community spread in December is faster. It's been faster, and the percentage of people testing positive is greater. Given both the overall safety and possibility that we will be unable to maintain adequate staffing levels, as we see that increasingly every day, staff is recommending that we finish the first semester for our traditional calendar schools and our multi-track year-round schools in remote instruction for all students, and that this would be between January 4th and run through January 15th. While remote instruction is far from ideal for many children, returning to remote after the winter break becomes really a prudent measure to ensure that we do not abruptly need to change these plans later on, closer to the beginning of second semester when data comes in after the winter break. It does provide us also an opportunity to position the district with the most current information as we prepare for the second semester that we have already planned for. As staffing is one of the few areas of this pandemic where we do have some control, I do want to take just a moment with you to share with you for a moment the summary of what we are seeing in our schools. During our first week of in-person instruction in October, we averaged 194 absences a day that required a substitute. This number includes teachers and any instructional assistants who are eligible for a sub, which not all IAs are. In contrast, last week, an average of 497 teachers were absent per day. That excludes Friday because it was a remote learning day. Because we have no confirmed secondary transmission of the virus in our schools, we do believe that this increase in teacher absences is largely attributable to the greater prevalence of the virus in our community, and therefore the quarantining based on exposures in schools. At the same time, our ability to fill the increasing number of teacher absences with substitutes is dropping. At the end of October, an average of 80.7% of our requests for subs were filled during the week. Last week, subs picked up an average of only 64% of these requests, and if I remember correctly, we had at least one day where we went below 60%. The data you see on this slide is captured from our district-wide absence management system. Schools use this system to enter absences that require subs and to request subs on a daily basis. This means that the numbers we have from this tool do not necessarily reflect other absences among teachers, IAs, and staff who do not require a sub. So the number of absences are higher than what you're seeing here. For example, the first number on this slide does not include absences in which an IA was pulled in to cover a class for a teacher and no sub was gotten. So when IAs cover for a sub and no sub comes in, you don't see that data in these numbers. And that happens quite frequently. Last week, we launched a new tool to collect the numbers of absences among all IAs and teachers, because only IAs who are special education IAs are eligible to request a sub. Regular education instructional assistants do not get a sub. So we need better information about who's in the building and who's not in the building, and we can't just get it from our subline. So we did launch this new tool, and I will talk more about that tool in just a moment. We should also point out that recruiting subs is not really the problem. We have 3,000 subs on the books that are available and eligible to work. In August, we surveyed substitutes prior to the beginning of the school year to assess their willingness to substitute in person and or virtually. At that time, more than 1,450 substitute teachers indicated a willingness to serve in person. But as of last week, we are only seeing that about 250 to 300 subs are regularly picking up jobs. This number is just not high enough to keep up with the increasing number of teacher absences. For example, in October, the highest daily total for teacher absences requiring a sub was 258. So far in December, we've had 2 days over 500. 557 on Friday, this 12/4, and then 545 on Thursday, 12/10. Based on our daily absences among teachers requiring a sub, we need about 400 to 500 subs a day. And it is much more challenging to fulfill those rates. In addition, the length of time that a sub is needed is no longer a day or two. Instead, it becomes a week or two when a teacher is exposed to someone who is positive and must quarantine. That may be an impact in the number of subs that are picking up jobs. Those realities, along with the challenges that have been created by the new and necessary health routines that we have in our buildings, do likely play a role in the percentage of subs that are willing to accept jobs. We're just simply reaching a point where it's difficult for our schools to ensure continuity, not just in the classroom, but in all the other operations in the schools in those other positions that don't necessarily show up because they're not required to ask for a sub. Any school on any given day might have the staff that it needs. And the next day, any given school could lose more staff than it could really realistically afford to operate efficiently. So it's changing. As we move on, as I mentioned earlier, the data in the previous slide is collected through our absence management system. This system primarily captures absences amongst teachers and special education instructional assistants who are eligible for a sub. We recognize that those numbers don't complete the picture of what might be needed in a school and the challenges that they may have with their business continuity, as many absences do not require a sub, and they are not recorded in this system. So in response to this challenge, because we asked the question, how do we really know how many people are not in the building any given day, we did come up with this form survey that our principals can fill out. And it is something that we've asked them to do. We piloted it with a number of principals. They helped create it. Team of principals, area soups, other district leaders, and it's a classroom coverage form is what we're asking them to fill out every day. This new tool launched a week ago on Monday, and principals have been asked to complete the form on a daily basis. Many of them are asking their data managers to support filling that out because those are the folks in the building who generally are tracking who's in the building and who's not in the building on a given day. So a couple of key data points as we aim that we want to capture in this tool. The total number of teachers at IAs that are not reporting to work in person or virtual each day. whether they got a sub, asked for a sub, need a sub. The number of staff that are reassigned each day to cover duties for absent staff members. Both of these additional points tell us more about the number of staff members who are not reporting to work each day and the impact that this is having on the school of reassigning folks and adding to their duties on any given day and how they're able to cover that. We've only got 4 days of data so far. As we said, we started this last Monday. It's too early really to see trends, but we can tell you a couple things. We are seeing differences in the data collected by our absence management system that requests subs and the new classroom coverage form. On Thursday, for example, the absence management system recorded 545 absences among staff members who required a substitute. On this same day, principals reported a total of 860 absences among all teachers and IAs. Principals also used this new tool to report that they had to reassign 367 employees to cover the duties of absent staff members. We are currently working with technology services to modify the tool some so that it captures the total number of all school-based staff members. We've not gotten all of those just yet, who are unable to report to their buildings. And that is important because of business continuity, but because it's also fewer adults in a building to do help with other areas. And we know that absences amongst administrators, clerical support staff, custodians, they do have an impact on the daily operations of a school. The goal is to revise the tool and relaunch it in January so we can continue to capture and study and learn from a more comprehensive collection of the staffing data. So to the proposed changes that staff is requesting today. You see on the slide where we are, where we were for first semester. For K-12 regional programs, we began in a 3-cohort rotation, and then we went to daily in person. For pre-K3, the same. We began in a 3-cohort rotation and then went to daily in person. We are currently daily in person for pre-K through 3rd grade and K-12 regional programs. Grades 4 and 5 and grades 6 through 8 are in a 3-cohort rotation at this time. And grades 9, 12 are remote at this time. The revision that we are asking for that will take effect January 4th through 15th would be to ask that K-12 regional programs and pre-K3 and grades 4, 5 change from their current model to remote for that 2-week period. And then grades 9, 12 remain remote prior to beginning second semester, which they would be anyway. There's no change there. As we think about the calendar, semester 1 for traditional and modified semester 1 ends January 15th, and so they would finish the semester remotely. Single track, which is all of our year-round schools that are on a single track 4, they actually track out and are not scheduled to come back until January 25th, so this would not have any changes to their calendar. They would come back on January 25th as scheduled. Our early colleges, leadership academies, and Knightdale High School, they end their semesters this week. So they will actually stay because they're in the middle of exams and those types of things, and with their college partners and courses and those sorts of things. So they would not have any changes this week. No one will have any changes this week. And they would start second semester remotely and go back to the rotations, which is what they're supposed to start with at the beginning of the traditional semester, which would be January 20th, I believe, based on some teacher work days and holidays that are in there as well. However, their students during those 2 weeks of January 4th through 15th, if there are community college or university partner obligations around classes, they would continue to meet those. And so likely they would need to have staff in the buildings and that sort of thing to do that sort of work. There are some other implications around the proposed changes. EOC testing and exams. would fall during this period for our high school students and maybe a few of our middle school students, but mostly it's the high school students. We don't have a choice here about continuing to offer those tests to our families and students. So that schedule will come out with exams during that period of time, and we will follow, of course, the protocols, have transportation available, unless some changes are made at the DPI level or the State Board of Education level with this requirement. We do not have a choice there. We know that a lot of our high schools do schedule mid-year graduations. They were virtual anyway. They will remain virtual, or they may want to do something in person similar to what was done with our graduation ceremonies last year, where they bring small groups of families in, like one at a time, to sort of have their moment, their diploma moment. They may do something like that. For athletics and co-curricular, the prior approved activities involving athletics, arts, and co-curricular activities will continue and be reevaluated as needed. Those are already going in place. Transportation will transport middle and high school students who need transportation for required exams. For staffing, we are probably looking at allowing staff to work remotely unless job responsibilities require you to be in the building, and I'll talk more about that in just a moment. For school building access, we do need to make sure that our buildings, our schools remain available to families who may need to come in to register or make some sort of changes with their students and those kinds of things. Essential business. Our child nutrition services, the food distribution sites, curbside distributions will continue. Big Bus food truck will continue. A couple of other implications. Now we're talking about fall semester exams. If it's a teacher-made exam, not a state-required exam, it will be administered virtually for all students that are taking a teacher-made exam. The student exam scores, and this is guidance that has gone out, will only be factored into the student's overall course average if the score on the exam is higher than the student's course average going into the exam. For state tests and, of course, CTE post-assessments, the requirement from the state is to test in person on campus. The requirement is to count the state test as 20% of the student's overall grade. Students do have the option, their families may submit a request for a medical exemption from testing, and we've sent that information home. I want to talk a little bit, as we look at the summary of proposed changes, on some of the work that has to happen with staff during the period of time as we move forward into January. We are not proposing any changes for the remainder of this week. We are asking that we delay in-person instruction and pick up with our plan for second semester after taking a pause from January 4th through 15th. The work that is before us right now is to dig a little deeper into what's happening with the staffing, recontacting subs that are all out there that are not picking up jobs, try to understand that. There's a piece around compensation for substitutes that we need to take a look at as we examine what those rates are around the state and in our district, and just understanding, for example, if safety is a concern, how we can alleviate that and what is they need to hear or see or feel comfortable about. We also know that, and you'll hear more about this tomorrow, but our efforts around contact tracing are going to require a local investment to hire some additional nurses, nursing assistants, to ensure that we can more efficiently and expeditiously follow up on contact tracing in our schools in partnership with the county health department. But really, there's more manpower needed in that area. And then the last piece that I will tell you about that I have talked to a number of folks about at both the county level and the state DHHS level, and it is whether or not it would be prudent or advisable to implement facilitate an optional but heavily messaged, we'd love for you to, opportunity for all of our staff to test in the days just prior to returning to instruction as an additional measure. And then ongoing to have options for rapid testing and those kinds of things as we move forward. Those are things that we are working on during this period of time as we get, and the truth is we'll have to work on all of them, whether we coming back on January 4th or after the break from January 4th to 15th in terms of pausing. There is grave concern that's coming out all over the place with our staffs around if this is what happened over the Thanksgiving break, what are we going to see over the winter and holiday break there? And the folks that we speak with have told us that these numbers will continue to go up. And so we do believe that it's not the secondary transmission in our schools that we're seeing concerns with, but it is, in fact, the impact of the number of people who have COVID that are coming into the schools or that are exposed outside of the schools, that are having to quarantine and having an impact on our ability to do our work. And we know that if those numbers do go up in the community, that we may need to have another conversation as well to continue to go up the way they have been. We did also touch base with our principals about this possibility of delaying going back into remote for a week or two. Still moving ahead with what our plans are for second semester at this point, but pausing for a week or two at the end of first semester. Generally, administrators were largely supportive of that. They are finding the realities of having to work in this environment as well, and the things that they need to do and learn and change a bit in order to be effective. And we also talked with STAC, and you remember STAC is one teacher per school. It's the Superintendent's Teacher Advisory Council. And the Superintendent's Teacher Advisory Council has asked the same thing. How do you feel about the potential for pausing for a week or two and going back into remote at the end of first semester? And that reaction was largely supportive, but also mixed, and the same mixed sort of comments that you get from some administrators. And that is the concern that folks have, that now that kids are back in the building, should we keep them in the building and not pause? While at the same time they acknowledge the rationale for why we might want to pause. They're really torn about the fact that it's important for our kids to be in the classroom, and I think that's important for all of us, that our kids be in the classroom. But I think it is important to go back to that language that we have to ensure that we're doing it safely. And if we're having trouble staffing, if we're not able to contact trace as quickly as we need to, which there was no way to know, the contact tracing burdens get higher as you have more people that are positive. So those are things that we're having to make some changes on and add some resources to. And I'm happy to answer any questions. And there's all kinds of folks that are online as well.
So thank you, Superintendent Moore. Board members, you've heard the recommendation from staff giving just to summarize, the 3 drivers around new additional information from the governor, collaboration and learnings from state and local health officials and ABC, and monitoring our own district plans. That we're obviously seeing some challenges with regard to staffing, and so the recommendation is for a week to 2-week period to go back to a remote learning status in between the end of the winter break and the end of the first semester. So thank you for that. I think that's certainly a prudent recommendation, one that puts us in more of a proactive than I think a reactive state, and looking at what we, as I said earlier, alluded to earlier, what we may be able to anticipate in a holiday surge, if you will, given what we've seen just from the 3 days or so from the Thanksgiving break, what we might anticipate over the 2-week break for the winter. At this time. So, again, thank you for the information, Superintendent Moore, the work that you and your staff have done. Again, outstanding work, and we appreciate particularly the information that's been collected and the extra effort that has gone to collect the staffing numbers and data to help us give a clear picture of what is happening with regard to staff. So at this time, I start with Ms. Kushner. Like, you have a question, I'm sure as all board members do. So we'll just kind of go around the horn and take those questions and answer concerns. This is just information, as you all well know, today. So this is just simply some discussion to help us, again, acquiring some context for the decision that will be made tomorrow in terms of accepting this recommendation from staff. So again, we're here this afternoon just to have some discussion, gain some understanding, and not only allow us to process some of that information, but to allow the community to hear what our challenges are as well, and to process that information and perhaps begin to plan for any changes that may be coming. So with that, I'll stop. And again, Ms. Kushner, you have the floor.
Thank you, Chair Sutton. And again, it feels like we're back in September with, we are getting, as my colleagues know, the feedback from families and from teachers and from our community with conflicting advice to us about keeping schools open or closing. So I appreciate the overview, because I think it's, again, the anger I feel because so many people have worked so hard to reopen schools, to get these protocols in place, to have our students be able to, and our staff be able to re-enter the buildings, but the realities of our staffing, which, staffing a school in January and February is difficult in a regular year. I want our community to recognize that. In a regular year, January and February are tough because of flu season, and here we're in the middle of a pandemic faced with staffing January and February. So my main concern is getting that solid start to second semester, particularly for our high school students who've been remote from the start. So if this pause, I'm looking at this reset of remote for 2 weeks, gives us the staffing strength, the data strength, and more protocols solidified so that we can start that January 20th in mind. I'm sad that for the loss of the early colleges in Knightdale having to start remote, but I think overall for our high school kids, I want to see January 20th be a date we can start the hybrid for our high schoolers. So that's my what's on the foremost of my mind. But I wanted to ask, because I know that Johnston County is in red, Harnett County is in red, and I think Johnston schools have gone remote starting yet today. So do we have a sense that we have a lot of staff who live in Johnston and Harnett counties who work for Wake County? Is that particularly for our southern and eastern schools? I know we pull from those counties. Is that correct, Ms. Moore?
We do. We have staff that live outside of Wake County, and if
From
it's
throughout our 20,000, and I know Charlotte-Mecklenburg has gone remote, and they are surrounded by counties that are in red, and at that critical stage. And I'm sure that there's a lot of influx of staff from a region, not just, we can't just look at Wake County numbers. We have to look at our region. But is there, and will we take these next few weeks to think through how we can shift staff? I'm glad to hear you say, incentivizing substitutes, because with such a large pool, I think we do need to aggressively pursue getting staffs in for those long-term assignments.
We do. We also, as we've dug into this more in the last week or so, there are some interesting practices out there that schools are engaging in to help figure this out, and I think the time to help flesh those practices out, have them be sort of shared school system-wide so that folks understand, what are some creative ways to deal with this. Getting the subs back in is going to be critical for us. I think looking at the revised guidance around quarantine and increasing our work around contact tracing will help with all of this as well. And then I think really it's the pause really has to do with seeing what the impact of the winter break numbers are on the spread of the virus in the community. And if we can implement a testing protocol also for staff to return that's available to them, that's quick and available very conveniently, that can also help us get started back right away. And so I think because, to Dr. Benjamin's point that he has made several times, the spread, the community spread number can be anywhere in terms of positive tests from 3 to 5 to 10. But if we're able to maintain and not have confirmed spread occurring in schools, and we can answer some of these other operational issues that have come up as a result of increased cases in the community that are now increased cases in our schools, that time is helpful.
There are schools that are having clusters outside Wake County schools, not in Wake. So I think we have to continue to take this seriously, because we've talked from the beginning. When we open schools, we want to keep them open, and if the staffing prevents that, again, I'm just focused on January 20th being able to have that second semester, because we heard so much from I don't want interruptions in instruction for the that are going to preclude us from having our schools, particularly at the middle and high school level, having our students in school. So that's just wanted to make clear my what's guiding my decision making on this. Thank you.
Ms. Carter.
Hi. Well, thank you. This information has been helpful. And as I was listening, some of the things that stuck out to me was, although Governor Cooper and Dr. Cohen have used the word dire multiple times, they have yet to change the recommendation for schools. Currently, they are saying Plan A for elementary and Plan B for middle and high school. So I think that's important to keep in mind as well. I am glad to hear about some of the outreach that is going to be happening with the substitutes, because I think that is very important. I know in previous years, this is a difficult time between Thanksgiving and the winter break, just with everything that's going on, then you add COVID. So I do think having actually ongoing feedback from them about what can we do. Are they really willing? Do we still have that many that are willing? If not, let's get some of that great creative recruitment like we did with the bus drivers going. I'm just saying I like that. And trying to be more proactive with stuff like that, and then giving them more direct, targeted information from the ABC Science Collaborative, I think would possibly be helpful. And I'd ask for some information about, just for the community and us as board and others as well, to have maybe a context of how the sub-fill rate would look in let's say last year around this time, so they could actually compare it, to, let's see, was it October and December dates? Sorry, I put that down. But compare it from last year to this year and where we stood with that, so that you could really see the difference. And I don't know if it's possible, but also maybe some school specific. I've had people say, and it just has huge implications about, closing one school, whatnot. But I think it also might help to illustrate how widespread the issue is, if that makes sense. And I think there was just one other thing that kind of just wanted to hit on, was the EOC and CTE grading. And I know I've had a lot of contact with that, and I hear all of y'all. But I had a question about clarifying they can delay correctly to May or June, and then the grade will be curved so that it will not have a negative impact on their Q1, Q2 average grade. Does that make sense? So like if they had, I think the example was like an 80 for quarter one and quarter two averaged together, and they got, let's say, a 75 on the EOC or CTE, that EOC or CTE grade would be bumped or curved up to match that 80, or if they got higher, they would be allowed to have the higher. But I think that might be helpful, because I believe I'm hearing a lot of conflicting information from the community members about what they are being told and the options. I know the medical that you showed was there, but maybe if there's some expansion on that. Thank you.
Yep. So I think there are a couple of folks that are probably listening that can provide some answers to both the medical exemption question, the spring testing option, and what's being communicated about the actual grades.
Ms. Moore, I'd be happy to take that. Yes.
This is Brad McMillan.
Oh, yes. Hi. The state has extended our ability to test kids all the way up until the end of June, even for a course that closes here in the fall semester. And so the communication that we've sent out to students and to families has said that if students are not able to come into the building at this point, they can take those tests, those CTE tests and end of course tests, as late as the end of June, according to the state. And so given that the state has extended us that flexibility, we are going to take advantage of it. Even though in some ways it kind of feels a little bit, from a learning perspective, a little strange to be taking a test on a class 6 months after you finish it. The state, because they've extended us that flexibility, we are taking advantage of that.
Medical exemptions are also available for families who have a high-risk situation with a student or someone in the household that for which a student coming to school just poses too much risk. That's a process that's been in place for many, many years through the state. We've never had to use it during a pandemic, of course, but that's a process that we've always had for students who are in unusual situations. And then the last question, Ms. Carter, that you brought up about the grading, yes, the way to think of it is a sort of a hold harmless provision. You can only improve your grade in the course by sitting for that EOC or CTE test. You cannot hurt your grade. So as in the example you gave, if I have an average of an 80 in the course based on quarter 1 and quarter 2 going into the exam, if I do better than an 80, then that exam will help my final grade. But if I score less than an 80, then 80 just becomes my final grade. So I can't drop my grade by taking the test. I can only increase it. And a couple of reasons for that. One is just that it's an incentive for students to come in and take those assessments. We're trying to show a good faith effort to making those assessments available to students as the state wants us to, even though we know that the circumstances are far less than ideal.
All right, thank you. That was very helpful. And I just want to say thank you to all the staff that are in our schools and stepping up every day and changing and covering and doing what all you've been asked to do. I just want to say that as well.
Thank you, Ms. Carter. Superintendent Moore, I just want to sort of support two of the requests also made by Mrs. Carter in terms of data requests. The yearly comparison that she spoke about, is that information that could be gleaned from what we have in time for tomorrow's meeting in the next 24 hours? Is that information we could get prior to
AJ, are you listening? Are we able to capture some comparison data from last year to this year?
So are we? Yes, ma'am. So was the request, Ms. Carter, for sub-bill rates for December of last year? Would that provide the context that you're asking?
Yes, I was just trying so that the community and, fellow board members, if they're interested, could compare just to see the impact of that. Yeah.
Yeah, so in terms of, I can provide that now. In terms of our fill rates for December of last year, we were, for the first 2 weeks, at about a 78% sub-fill rate. And generally throughout the year, we look to 80% rates, somewhere along those has been a pretty good, pretty typical fill rate for us on any given week.
All right, thank you.
And then the other question, Superintendent Moore, about the challenges that we are seeing now. One could assume, I think, that or at least it appears to be more countywide and not school specific. But are you seeing rates that are more specific to schools? And I'm assuming that where that question is going is that in the recommendation to pause for the 2 weeks, could it be certain schools that would pause as opposed to being a district-wide closure, as I'm assuming where you're going with that question?
I don't think we have specific data that we could pull on. We know that some schools are struggling more than other schools, clearly. We know that some schools have either not had many teachers out or they've been able to cover in some way, shape, or form. But we are hearing enough from enough principals on a daily basis, and we're finding ourselves more frequently having to engage in conversations about, closing a whole grade level or portions of a school. And because it's widespread across the entire district, but not every school necessarily. But we don't have the time to get that sort of data specifically because it took a while to get to what we have right now, and to go backwards to try to figure out for all of those days how many people we're actually talking about and how many people they had to cover. I don't know that we could get the specific data by tomorrow. And again, for us, as we look at pausing for 2 weeks in January, it's about acknowledging that the data is going in the wrong direction, and the sub coverage and the numbers of absences increase, the subs are decreasing, and we need to make some changes to be prepared for coming back and making sure that we're strong as we come back.
I can add to Superintendent Moore something that and starting to look at some of that data by school, it's very unpredictable, where a school could be okay on Monday and Tuesday, but then they get a couple cases, and by Thursday, Friday, those needs increase. And when you look at sort of the unpredictability of the schools, coupled with the potential unpredictability of the break here, that's one of the reasons I think it could help to have remote for those next 2 weeks, just so we can see what that impact might be and adjust to it as needed.
Okay. Thank you for that. Ms. Carter, does that? Okay, thank you. Mr. Hagerty.
Thank you, and I appreciate the comments and the questions that have been brought up from the other school board members. They addressed a number of the questions I had. Just one last thing about the EOCs. Ms. Carter had mentioned something about the grade scale and the flexibility we might have. Mr. McMillan, I didn't know what sort of flexibility. Have we looked at a serious proposal for something like that, or is that something beyond just the flexibility with the dates that we would consider?
Yeah, Mr. Hagerty, we have also implemented some flexibility with the grading scale that the state allows us to do. The state has always allowed districts to determine their own grading scale for EOCs, and this year we've got sort of two allowances that we're giving. One is the one I mentioned in the answer to Ms. Carter's question a few minutes ago about if a student scores below their average that they have going into the final, that their score will be curved up to their average going into the final, such that a student's grade will not drop because of their performance on a final exam. And then the second aspect is that we've created a floor of 60, whereby the lowest possible score a student can earn is a 60. And the reason for that, and most districts that we talk to around the state are doing a similar thing, is to make sure that no student fails the course by virtue of their performance on that exam. And so we've created a floor as the lowest possible D, so that way a student is only going to fail the course if they've in fact been earning failing marks all along during the first 2 quarters.
Thank you. That helps a lot. I had just 2 other questions. One thing that was brought up when we talked about staffing during this time, we talked about, it's possible that staffing could be remote, quote, unless job responsibilities require them in the building. Could we get a little more explanation of exactly what that
Sure.
means? Because, in the past, we've had virtual academy
Right.
instructors, but they've been in the building.
So, for example, if a high school teacher is needed to give an EOC or a CTE exam, we have to staff those. I think that was there may be some other examples that folks may have out there, but that's one that came to mind, that we know that if the folks need to be in the building to fulfill a duty or responsibility, then they have to be in the building.
Okay, just for more clarification for anyone on staff, like our high schools right now are completely virtual, with the exception of some, organized activities, extracurricular activities, and the regional programs. But we do have high school teachers reporting to the building every day. So would we see more of these staff staying at home, or would it continue as normal as is now?
You were talking about during those 2 weeks?
Yeah, during those
Right.
2 weeks.
So I think that the intent of taking the pause is to take a look for the district to bolster certain areas of need that support schools, but also to take a look and see at what happens with the metrics in the community and make sure that folks are ready to, if something is happening as the numbers continue to go up, do we need to continue to assess what the impact that is on our schools? I think that not being in the building supports the need to be as safe as possible, but I don't think that we can just blanket say that everyone will telework during those 2 weeks, because we do still have things that are going on in schools that are going to need presence of adults in the building. And we also know that some of our staff would prefer to be in the building and deliver remote instruction. So what I'm advocating for is some flexibility there. We know that may not look the same for every person everywhere, but we know that some will want to be in there, some will need to be in there, but the fewer folks that we have in our buildings during that period, the better we are towards getting ready for reopening also.
Okay, great, thank you. And then my last question is, several times during the presentation, you talked about the difficulty for a school to ensure continuity and use this word continuity, continuity, and continuity. And so I want to be clear exactly what that means. By continuity, do you mean our ability to guarantee a business-as-usual workday with the same quality of instruction? Or by continuity, is that a fancy way of saying we can't teach a class because we don't have any teachers there?
So it's sort of both. It is about the quality of what we're doing being impacted by a lack of adults that are able to work with students in the building. And so it's both the quality of what we're able to do and then just the ability to do it. When we are in, for example, rotations with smaller groups of students, the ability to double up a class or spread students out when a teacher's not in the building is much easier than when you've already got a full class to begin with. So with the model that we currently have in place, as we're thinking about how we plan to begin second semester, it's going to be important that we have a solution for teachers who are not in the building or who might need to, adults that might need to quarantine.
Okay, but have we seen cases where there have been grades that have had to go back to remote because we haven't been able to staff a grade?
We have one this week.
Okay.
Today. So we've had several. We're already implementing that with the leeway that's given in policy to move a group for up to 2 weeks, but no more.
Okay, thank you.
Ms. Mahaffey, then Dr. Martin, I'll come to you.
Thank you, Chair Sutton. I also had a similar thought to Ms. Carter about our substitutes and whether it's needing to be marketed like we had with our bus drivers. What I'm hearing is we have the people, they're just not coming in for a number of reasons. And so I appreciate, it's kind of like a both and. Can we do an info session for current subs and also let folks in the community know who are interested in subbing where they can find that information? Superintendent Moore, I'm curious about the impact during the pause on our CNS and transportation staff and what that will look like for those employees in our community.
That is a conversation that we have had. We anticipate that during that pause, well, because our big bus food truck and food distribution efforts will continue, that we should be able to take care of CNS that way. And then I think that in some cases they have been involved also in the big bus food truck for transportation. I know that we've discussed it, and David Nieder has said that he thinks that we'll be able to work through that without having to impact those folks during that period of time. And I would invite him, if he's on, to give any other thoughts on that.
Yes, Ms. Moore, that is correct. We are in the process of reviewing the number of drivers and child nutrition workers we will need for those food initiatives that Ms. Moore just mentioned. We're also looking if we have a delta between the numbers needed and the number that we employ of finding other duties for them that will add value to the district so they can continue to maintain their normal hours during that period of time.
Thank you. I'm also curious, we heard Dr. Benjamin talk about getting more testing within the community for staff and for our school families. And I guess this is a question for communications is, do we currently have a link on or a way for families when they get sent home with a headache or an inability to smell or any symptom that may be COVID, communication that includes where testing locations can be found? And if so, are we able to add that to the communication or at least put it on our website so that even if it links to DHHS or the county government, so that people know where testing is in the community, because it does fluctuate. It is in different places at different times. I know the county has made some testing in one specific place, but just how people can get access to testing, whether they're staff or school families.
Ms. Mahaffey, that you're correct. A link would probably make the most sense in a situation like that, simply because if you put it on the website itself and then it changes, you run that risk of it behind. But yes, I think that's something that we would be able to put in the updates.
Okay, thank you. Those are my questions, Chair Sutton.
Thank you, Ms. Mahaffey. Dr. Martin.
Thank you. Let me begin by saying thank you for the provisions that you put in place for the EOC CTE testing. I think that having the floor provision makes sense, as well as the hold harmless provision. At the same time, I want to just reinforce, not unlike what we were talking about during the Student Achievement Committee meeting, these end of grade tests, or these end of course tests, are frankly not terribly pedagogically sound. They give us some broad information for district level perspectives, but they're really bad assessments for individuals. They're really testing, how well do you test? Do you fit into the bias out of which the test was written? That's all they're doing. And so I just think, anytime we talk about this, I think it's important to reinforce that, these tests are really not pedagogically sound. We have to do it because of the state. And I'd love us to stand up and say, nope, we're not even counting them as part of your grade. I understand that that's a different level. But anyhow, the floor and hold harmless are, I think, appropriate. Thank you. With respect to the pause, I do think it's a prudent recommendation. And I think it's important to emphasize that this pause gives, and Ms. Kushner noted this as well, this pause gives us the greatest chance to be successful for sustainable in-person instruction. And I think that's the reason to consider this, because we have to look at it and make the decision what is going to give us the best long-term value. And the last thing we want to do is sort of, have to open and then close down. So the pause is really for the greatest long-term chance for in-person success. I think it's also important for us to make sure we're careful about our language, because we're not talking about being open or closed. The school system has been open since the day one of schools. We're talking about remote versus in-person. Remote does not equal closed. And I just think it's really important that we keep being careful with that language, because I can tell you from an educator, a teacher's perspective, anybody in the school's perspective, we've been open. It's just, are we offering remote instruction or are we offering in-person instruction? On the substitute issue, I think it would be helpful for people to also think about a little bit of the math here. So 80.7% of the 194 needs that we had in October translates to 156 subs. 64% of the 497 needs translates to 318 subs. So we have basically twice the number of subs who are responding in December than were responding in October. The 80.7% being roughly the 78 to 80% of last year. I suspect last year we didn't even have the 194 needs. So I think it's important to put that in context, because the data suggests that our subs are actually stepping up to the need. It's just the need is that much greater. So we have twice as many, based on these numbers, we have twice as many subs in responding yes than normal. So hats off, thank you to all the substitutes. But our need is getting greater, so we can't just look at percent of fill. We have to look at actual numbers. So, if we're talking 500 subs and we needed and we have 3,000 subs on the books, that's saying we need 16.6% of all subs to respond every day. That is a higher statistic than is normal. So this means we have to do different programming. Maybe it's creating, a different incentive structure. I don't know. It's a different staffing model. It's not saying, hey, subs are afraid to step up. Quite the contrary, twice as many subs are stepping up as normal. So thank you, subs. But that is the challenge that we have to work on to try to address this staffing problem. I think it's important to put it in context. I don't have the exact numbers, but I remember a report on NPR several months ago about manufacturing plants, and many manufacturing plants, because of COVID, actually increased their labor pool by 10%. We're talking on the order of maybe a 5% right now. But we're not seeing something that is unusual in these numbers. What we need to do is think about a staffing plan so that we can handle what is normal in many labor markets. So those were just a variety of comments. My question is, when we return, it is still my concern, as you all know, because I've expressed it many times, that we adhere to all 3 Ws. CDC is very clear on it. All guidance is very clear on it, that we need distance, and distance really is not as big of an issue as lowered population density in any room. And so my question is, could the recommendation be modified to ensure that as we return on January 15th, we actually adhere to all 3 Ws and create a structure where we can actually have the reduced population in classrooms so that we can follow all the guidelines to make sure we have the safest opening of schools?
Dr. Martin, I will respond to that. I think staff has made their recommendation. I'll leave it up to Superintendent Moore or staff if they want to change or modify the recommendation. I can suggest that once that recommendation comes from staff in tomorrow's meeting, if you want to make a motion, also any board member can make a motion to add to that or adjust that recommendation as well. And that's probably the best way, I think, to handle that from a parliamentary procedure.
Sure, I fully recognize
Yeah.
that. I'm just suggesting that if staff would be willing to do that, then we wouldn't have to do it as a board motion. But that's why I'm offering it today in the work session.
So
My
So
request
Dr. Martin,
is
was
that
that-
when we return on the 15th, our plans follow all 3 guidelines: the wear masks, the wash, and wait the appropriate distance apart, which really is the distance requirement. I'm sorry, when we return on the 15th, well, I think Dr. Martin means tomorrow. My request is that the plan, right, we're going, the recommendation is to go remote from January 4 to 15. And then when we come back at the beginning of second semester, my recommendation and my request is that we consider that our plans adhere to all 3 Ws. As many have noted, right now our plans adhere to 2 of the 3 Ws. And from all guidance that I'm able to see, and I believe from our own data, it would be wise for us to adhere to all 3 Ws. Again, my goal is to have the greatest success of long-term staying open, and that's why I would make that request that we have plans in place that adhere to all 3 Ws.
So let me give me a second. I'll come to you. So as you then explain that further, what I hear a difference, because what you're talking about is the plan to return for second semester.
Mm-hmm. That is what I'm saying, right? We're talking about a pause, and then how do we return from the pause? They are related because our goal is long-term success of staying open. And how we do that, right? There's lots of hows that go into it, you know. But I would like to see the hows include all 3 Ws.
So the recommendation that is coming from staff right now covers a period from January 4th through January the 20th. And what you're talking about is adding to the second semester opening that begins January 20th, which is already one we've already voted on, and this one we'll be voting on tomorrow is on the pause for that period. So that would be, in my mind, sort of 2 separate motions, and I'm not sure how we would take care of what you're suggesting, because that plan has already been voted on, so we would either have to bring up, again, a second, so I mean, we can't change that, but I think that would be a separate motion as opposed to staff amending its recommendation, because its recommendation is limited to the period covering January 4th through the 20th.
So,
It's my understanding staff could make whatever recommendation they wanted to, but if that, I mean, that would be a way to handle it as well, yes.
right, so just to clarify our intent. Our intent would be to bring, we would have to add an action item to the agenda tomorrow to move to remote for the period of January 4th through 15th for all schools that are in session at that point in time, returning to the plan that has already been adopted by the board for the beginning of second semester, which is either January 20th for most schools or January 25th for multi-tack year-round schools. And for those that have already begun second semester, like early colleges, they would begin their whatever plan they're in, which is rotations, that January 20th as well. We are not bringing an action item that anticipates any changes to the beginning of second semester. That was not staff's intent. If there is a desire to examine the beginning of second semester plan, I would leave that, as Chair Sutton has said, to the board to determine what kind of energy there is around that and how you would want to proceed.
So I hear the recommendation, Dr. Martin, and let us take that under advisement and some discussion, because I think what I don't want to do is sort of confuse or muddy the water with what we're doing right now around the pause, and our, as you're thinking ahead, that there would be more discussion around the second semester plan at our January 5th meeting. So it may not appear on the agenda tomorrow, but I can assure you at least there will be opportunity between now and the 5th to take up more discussion about that, and then if the board again sees fit to or feels, or if there's some energy around changing that, we can take a look at that then. Is that fair?
Yes.
Okay. Thank you, sir. I appreciate it. Ms. Cash, does that answer your? Okay.
In the health world has decided that 6 feet or 3 feet with masks I think it's 3 feet with mask.
Well,
So
again, I think that
that's what
would,
I mean.
again, so
That was
that's
my
a whole
question.
other discussion, but I heard you ask for some clarification around what the recommendation was, so I just wanted to make sure that everyone was sort of clear.
Yes, it
And
did.
just trying to keep things somewhat compartmentalized, particularly for those that are just joining. Mrs. Scott.
Thank you. I do want to add that this is incredibly difficult, what our schools are going through right now. And I think there are more people, I know there are more people who are covering, who are going in to help at schools than we're even aware of. I mean, other employees, I saw this morning on Twitter that a school took a picture and said, we're so thankful for this other school for coming over and helping out with screenings. And I thought that is nice, that is very special, but at the same time I was frustrated that that's where we are, because that's the time that those individuals took away from their other assigned duties. And this is clearly related, this community spread that we're seeing is clearly related to people not taking COVID seriously. And our community has got to take this seriously and understand the science. These masks work. Ms. Cash will tell you, she works in a hospital. She is around COVID positive people every day, and she's healthy. Masks work. And I get so angry, and I don't want to go off on this right now, it's not an appropriate time, but I get so angry when I see members of the community not taking it seriously. And we're sitting here doing everything we can to keep our schools open, because we know, and teachers know, that the best place for students to learn is in those classrooms. And yes, there are students who are thriving in a remote setting, and that is, I'm so thankful for that. And there are teachers who have figured this out, and they are doing a phenomenal job, and that is great. But we know that we want to have our schools open and leave that option there for the people who need that and for the people who choose that. And we can't do that when I turn around and see people gathering maskless indoors, congregate. I mean, it's so frustrating. So I will stop that, as upset as that makes me, and moving on to during this time, because and I apologize if this was explained and I missed it, but would the FAST program still be operating for the schools that are during the January 4th through the 15th? For the employees and working parents. I know we have our own program, and I'm sure that the YMCA and our partners is a separate question, but.
Tim.
Excuse me. The YMCA, yes, you're right, will continue to operate beginning in January and throughout, but we will not stand up the FAST program from January 4th to January 15th. There's a number of reasons for that, but the bottom line is that the amount of time it takes to stand it up, the amount of time that we would be in pause is almost a wash. We would barely get it stood up. So during that time, and I'll defer to AJ if I'm wording this incorrectly, but during that time, employees will, if child supervision is the issue, will be encouraged or be able to telework if possible.
Yep, correct.
And for those families who were still, like our 4th and 5th grade families who had been using this program, the YMCA, you said, is who are using other partners, YMCA, I know Boys and Girls Club, and that they're continuing. And just so
those have really developed into two very distinct markets. The WCPSS employees are one market, and the non-employees are the other. Obviously, well, the Y and partners serve a large number of kids. There's a large percentage that are not of non-employees who don't need or take advantage of what the Y and the partners offer. What I'm referring to is just the FAST program for employees. That is the portion that like I said, it's just the mechanics of getting it up and running for 11 days, it just doesn't work. So we've landed where the option would be that if child supervision is needed, teleworking is encouraged because it's such a short amount of time.
And yes, thank you for that. I can understand that. But so our employees then who have school-age children would be, we're planning on allowing them the option to telework from home so that their children would be home and supervised during that time period.
Yeah, and again, I'll defer to AJ if I'm wording that incorrectly, but yes, that's the basic thrust of it, correct?
Yeah, that's correct, Tim.
And that was it for my questions. Thank you.
Thank you, Ms. Scott. Ms. Johnson-Hustler.
Thank you. We'll just go down the line. Thanks, Ms. Cash. Thanks for answering the FAST question. I checked that one off. This one, I think, probably is going to be a quick answer, maybe for Tim. And again, I won't go back into detail about how I also feel about standardized testing, but it's about the communication to families about what this means. Again, we have a habit of saying this is what we're going to do, but honestly, when I read this, I wasn't sure what you were saying either. So I'm asking about our clarity. I wasn't. I was like, does this mean we have to take it? What are we saying here? So I guess I'm asking Tim or anyone at this point, do we have a plan for clear communication to families about what this actually means? And I literally mean clear, like, if your child shows up, then this. If your child doesn't show up, then this. This is the latest your child can take it, and this is what the score means. Sorry, I don't have it back up here, but literally when I read this, I was like, I guess you're saying if I make an A, I get an A, or if I have a D and I make a B, I have a B. I mean, that's not written for people to just read to understand. So are we going to communicate clearly what we're saying here? I'm good.
I think it could be, that could be a Tim question, but I think it's really, the guidance that we have provided to school-level staff around how exams will proceed, and your question is, how has that been translated into parent-friendly, user-friendly language, even so simple as
or
like
student-friendly. I actually heard before I walked out of my house, which I was late, my daughter's teacher explaining this, and I was like, well, that's the best, thank you. Seriously, I did, because she's remote, so I could hear what her teacher is saying. So I guess I'm asking for parents who aren't standing over their child.
Right.
Usually I'm not, but I happen to be today.
So what,
not good.
and I'm not sure if this is a Drew Cook question or Brad McMillan question about what, have we only sent information to principals about this?
I believe we sent information to schools, and I think where Ms. Johnson-Hostler is kind of hitting on a good point here. I think what we did is a lot of our communication was directed to schools, knowing that that would be the first place that parents would go for information, and then expected them to be able to communicate to families what's been going on. And so there may have been, that may have been why our communication was not necessarily all that parent-friendly, because I think a lot of it's been targeted at schools, thinking that they would be the conduits to parents. But if we can get something out there to give people more clarity, we can certainly do that. I don't see that being a problem.
Well, I think maybe part of the ask is about how we can support schools and how they message to families.
Yeah. Again, the teacher my daughter had for her CTE did an exceptional job of explaining it. But that's when it hit me as, I did not understand it that clear. So you've done your job, or at least with that teacher that I heard, I will certainly say it was successful. But thank you for being willing to provide supports to everyone so that every parent who didn't get this will get it, or teacher who may not have gotten it clearly as well. Again, I certainly echo my colleagues' comments about being creative around subs, and I appreciate that. And I also learned a whole lot about subs during getting emails about the lack of their pay increase. We'll come to all of that, but I think it's important to note that this is probably the most information I've ever gotten about subs is through the emails that we're receiving currently through subs. So it has been helpful to kind of glean more information about ways that, and I certainly have heard some of that from both Ms. Scott and Ms. Mahaffey from their experiences, but I do think we got to calendar it at some point to go back and have this discussion, because again, we know the pandemic isn't going away. How we may be reacting will, and so we can make some short-term creative alternatives for subs like we did for bus drivers, but I also think we have to put it on our agenda to discuss what is sustainable moving forward for Wake County subs. That's the clarity that I feel like I got from the emails that we've received from subs. Additionally, again, back to communication to our schools about the use of those subs who are in the pool. I know it's so much easier to say, Monica, can you cover Heather's class? But I also think that the more we are verbally giving people permission to say, that's what you would usually do because it makes sense. But again, these aren't usual times. And so we have subs in this pool who are willing to take it, so let's do that. And not actually make the burden even increased on teachers. Again, I think these things seem like simple things that we probably don't normally have to think about. And so I feel like some of them we have to say out loud more than we ever would have, because our natural inclination is to do what we've always done. And it's not working, and people are exhausted, and we all know that. So just a reminder that it's okay to actually use the sub, even though this other teacher could take on that duty. It really, and I know that we've said that, but I also know that sometimes the data manager who's managing that, or the principal, or even the teacher who says, I don't really want to use a sub, so I'm just going to call my friend and have them cover it. We know all those things happen in the building, and so the more that we can communicate, that's not our expectation of people during this time, the better, is that we really expect for you to take the opportunity to utilize our subs, and we will continue to do our job to build that pool to the best of our ability. We also got lots of emails that people were letting us know they'll be happy to sub now that they know they don't have to have a teaching license. So again, we're already getting emails, or at least I am, that people will raise their hands to be subs. So I think, again, communicating to people our expectations can't be understated enough. The last one is bigger, which is why I wanted to go last and not Ms. Cash, but I think I'm going to just say it, and then I'll punt it to her because I'm pretty sure she's got a lot of follow-up after me on this. And I think I said it before, but we certainly as a district pride ourselves on the best teaching and learning and therefore none of us are in denial that the best teaching and learning is in person. However, I personally, Monica, is not creative, and I think it's time for the people who are creative to share with us ways that we can actually do this differently. I have resolved that we cannot do what we always done. We can't put every single certified teacher in a building, in a classroom with a student. It's not feasible. Even if the COVID numbers are 80 for 192 schools, that's not all the teachers and school personnel who are quarantined, because their number might be not reflected, which you've heard Dr. Martin say numerous times, because it's not them. They're a secondary person, so they're at home. That's not capture for the community. The community doesn't have any idea that when we're talking about sustainability in our buildings, we're not just talking about our frontline educators. We're talking about the people who are being impacted secondarily, and so they're not at school either. Every single person that's not in that building currently counts, because we're still running our schools the way we did in February. We cannot sustain that. And if we know and believe that we want children to be in the building for in-person learning, then we have to think about how we do that, and it can't be the way we did it in February. So if we certainly think that we're going to do February business in January, we are going to be back here talking. The community is going to still say we don't know what we're doing, and they're sort of right if we keep trying to wait it out, and hopefully we're eventually going to figure out how to make February 2020 the same in January 21. It's not. And I guess for me personally, I feel like over the weekend, I had to really come to the realization that I've not publicly said that, and for me, I publicly do not believe that we can maintain school the way we did in January and February. And while I know what we did before worked better, but we know it wasn't the best for all students. So why are we afraid to do something different when we already weren't doing the best by all of our students? We know that. And I know part of the fear is there's lots of rules, but I also think if there's a time to buck the system, it's now, because it is for our students. I mean, many of us are being directly impacted every single day by watching our kids. We know the impact. We know the whole country is experiencing it, and we can keep saying it could be a year of a wash because everybody's going to be washed. You all, we still live in a competitive environment. Just like we're trying to do school the way we did before, the workforce is trying to do work by hiring the same students. Colleges are still trying to give scholarships to the same students. So we can say it's a wash across the country. It doesn't matter. The reality to students and families is the expectation of them is the same as it was in January, because everybody's afraid to do something different. And again, I'm fine if WCPSS doesn't do something different, but I can't sit at the board table and pretend that I think that we should keep doing business the way that we are, because we have to get our kids back in the building, and we have to protect the people who can't be in our buildings. And yeah, both and. And I don't know how you do that. So I'm making a plea to people who might have an idea, because I don't. But I also know that we cannot watch our kids do this. We can't. And they can't sustain it, and neither can parents and families. And we're talking about people who have a lot of resources can't sustain this, right? We're talking about people with good health insurance who can get a therapist, and we still can't sustain, the Hostler household, we are still struggling to sustain the way that we are operationalizing now. And again, you're talking about somebody who, as I tell my daughter every day, now, my family probably would not be able to sustain it this way, but we can, because we do have some resources, but it's still hard. And I would be remiss, and I try to never bring my daughter into the table, but I'm telling you, this is hard. It is really hard. And I'm also telling you I don't know the answer. So there's no expectation that anybody answer this, but I just had to put it out there because people are being creative. And I'm just here to say that all of the fear, because I'm a very cautious, calculated risk taker, and by saying this to you is throwing all of that out of the window to publicly say I don't have the answer, but this isn't it. So that's why I said I'll just kick it to Ms. Cash, because I don't expect a response.
Well, I'll respond and just say thank you, Ms. Johnson-Hoster, for the comments, for the courage, and always your passion and honesty. So thank you. Thank you for that. And while I don't need to ever sort of paraphrase or do anything with Ms. Johnson-Hoster's comments, I do want to underscore her point about message and what I heard too, and that was, there is guidance to schools, and then there is messaging to students and parents. And even though the message may be the same, the language will need to be different. And I think sometimes we rely on the guidance that we send to schools to end up being the message that goes to parents.
Great job,
And that-
Chair Sutton. That's
yeah,
exactly what I meant.
And that doesn't work. So just for what that's worth, that there's some effort to kind of synthesize that guidance to schools so that it's clearer, because we use often jargon and language and everything else that may not be as clear to our students and parents. So, yeah. Mrs. Cash.
I hate to follow that, but she said it really well, and I'm worried about, of course, public education, and I'm worried that we just cannot keep closing our schools, and I know having staff is a big consideration, and what Monica just said about we just have to do it different. We got to do it totally different. And whether kids need to be in their classrooms, whether it's with a certified teacher or not, and I don't want all the teachers to say I don't think they're important. I think they're the most important people in there, and they may be on a computer in there. But we got to have the kids in their classrooms. And one thing about that I don't want to happen is for our parents to not trust our teachers anymore in public ed, and our teachers not to trust our parents anymore in public education. And I don't want that to continue. However, I do not want to see any more I will look at them. I'll probably look at them for sure. I'll definitely look at them. But I can't handle any more videos of small children sitting at their computer crying, and watching our own kids sitting at their computer crying. And I know, as we say, we're not closed, but remote learning does not work for a lot of these children, and it's really hard to watch that. So I want to talk about the students, because we need to figure out something different for them, where they're with other children, with an adult in a safe situation. I do see COVID every day when I go to work, and it's a real thing, yes. And so COVID is a health issue, but depression is a health issue too. And so in our ER right now, we see both. They all come in, both depression and COVID takes lives. And we have a snapshot in our emergency rooms of our community. So what we are seeing, and the pressures that we're seeing on our teachers, and the pressures we're seeing on our families, and the pressures we're seeing on our children sitting at a computer, is something we've got to, as you said, be creative. We've got to come up with a plan that brings adults into our buildings, not to take the place of a certified teacher. I just want to make that clear. I don't want anybody to say that. I said teachers weren't important because they're the most important thing ever. But we have to have kids coming in. So I'm just saying we need to staff our schools with our community somehow. And then this is a community problem, of course. And one thing about masks, we are not going to have a big flu season this year. Those are way down, so that's a good thing. We won't have a big flu season, but maybe if we have more of our community in our schools, everybody would be behaving more. And I agree, Ms. Scott, I appreciate you saying that. We are seeing things that we wish we didn't have to see in our community. So I'm just pleading with staff, who's done an amazing job so far, to come up with something creative, or anybody out there that wants to do something creative about bringing work staff into our buildings so our kids can go back to school, or those that want to, that are not in virtual academy. So I think that's my biggest plea. I just want our children not in front of a computer all the time. That's it.
Can I just quickly add, to your point, and I think it's absolutely right, Roxy, we have to remember that remote should not equal online all the time. I think that has been, right, to Monica's point about doing something differently. I don't think we have done that differently enough, because we have let remote equate to online sitting in front of a computer. And
They could be in a classroom with a teacher on a computer, but they could have an adult doing something else with them.
even at home, you can be doing stuff. There are creative things to be done. I mean, look, back
If you have a parent
in the dark ages.
If you have a parent at home with you and
Back in the dark ages, remember what public broadcasting used to do? I mean, these are some of the creative partnerships. We've got to think differently, as Monica was saying, and I could not agree more. We have to think differently, not trying to fit the classic 6-hour day school into what we're doing right now. That doesn't work. That's a square peg into a round hole. So remote cannot equal on the computer all the time if we want success for our kids and health for our population.
And I think
but I just to say, I am actually talking about their relationships too, like being with other children, and if not at home with somebody like a grandparent like me, that's not near as fun as being in kindergarten class somewhere. So we just got to be, you're right, we got to be very creative now.
Thank you. Ms. Kirshner, did you have
I
any
was going
comments?
to piggyback on what Dr. Martin was saying, the asynchronous days. If we can do, I'm sure staff will follow up, but that could be one place we could see what creative work was done and how was time best used. It can't just be, to Ms. Johnson-Hostler's point, piling on more work in an asynchronous day. How did our staff, our teachers, our students use that time in creative ways that we can learn from? That's something different. Just one example.
All right. I think that does it for questions from board members here regarding the recommendation from staff. I do want to just sort of bring this portion of our agenda to a close and say that again, it sounds like a very prudent recommendation from staff, one that would, again, asking us to consider a pause before moving into second semester, and would not only give us a pause, but really provide somewhat of an opportunity for a reset. And I think I heard Ms. Kirshner use that language, and to help us sort of reset as we move into the beginning of the second semester, so that we have a nice, robust start, and that most importantly, we can stay on course throughout the spring semester. I think this not only gives us an opportunity to pause and look at some of the trends and data, but also to take a look at our staffing challenges. But I would imagine too that it helps us look at an opportunity to reset and look at things such as PPE and things at our schools, cleaning supplies and that sort of thing, as I'm sure that there will be numerous supply chain challenges and that sort of thing. And so it helps us to put some things in place and just really kind of beef up our stock around those things as well. So I think this, in essence, gives us a number of opportunities to reset, to pause, and really prepare for a second semester and take a look at the things that we might be coming down the pike after the holidays. So, Superintendent Moore, any other comments with your presentation or final thoughts?
So just sort of as a summary and next steps. What staff has proposed is that for the period of time between January 4th and 15, that we pause from in-person instruction and go back to remote learning, and that we resume in-person instruction as planned for on January 20th or 25th, depending on what calendar you're on. And that will allow the staff some time to do both work around what we're seeing with the subs and some of the suggestions that have come up here today, as well as the things that we've talked about with human resources, whether it's touching base with them again, ensuring that they feel safe in our schools, looking at whether or not, if we were going to make a change to compensation, that would need to come to the board for action if we were going to do that. So just that might be on the horizon as well. You'll hear more tomorrow about the efforts around contact tracing and how we need those efforts to be in place and ready to work as well as we are back in schools. And as I am able to provide you more information about this notion of how we can facilitate rapid and close to the beginning of returning to school testing for all of our staff members across the district, I think would also be helpful. So those are all things that you'll hear more about as we move forward. But this would require that we make a revision to our agenda for tomorrow, and I will work with Melissa Allen on doing that.
All right. There are no further questions from board members at this point. Again, thank you, staff, Superintendent Moore, for the recommendation. Thank you, board members, for your time this afternoon. Ms. Scott, thank you for allowing us to take some time after student achievement and moving your agenda for us to take this time. I think this was time well spent as a board to have to receive some of this information, synthesize, process, ask some questions, and of course, as Superintendent Moore said, we'll be ready to take a vote. I'm sure that we will hear from staff and particularly the community. So please feel free, as I know that you will, send us emails with your thoughts, input, questions, concerns, and we will be prepared to take a vote tomorrow on this recommendation from staff. So with that, I'll call this work session adjourned until we take up business on tomorrow. Thank you all for your attention and time this evening, and have a safe trip home. Thank you.